If you have instability of a joint, especially the shoulder joint, where often it's multi-directional instability, generally shoulder instability is in the front, so it means the glenohumeral ligaments in the front are damaged or stretched out. And let's be honest, if they're stretched out in the front, they're probably also stretched out in the back, because often the person has had the problem for months, years, a very, very long time. So the more time you've had an injury, the more likelihood that the problem is very diffuse. So you need to get diffuse prolotherapy. It means you have to get prolotherapy in the front, the top, the side of your shoulder. So that type of prolotherapy is very effective at getting rid of multi-directional or very diffuse instability. Now, typically the person has to get 3 to 6 visits of prolotherapy, but the good thing is you can still train while you're getting Hackett-Hemwall prolotherapy. The sports that typically have shoulder instability would include any sport where there's a lot of shoulder motion. That would mean swimming or tennis, because tennis and swimming, is a lot of shoulder motion. But you got to realize any sport that's physical, where you could get smashed in the shoulder, for instance, hockey, rugby, football, any type of collision, into the shoulder is, potentially going to cause shoulder instability. I should even say that if somebody has had the diagnosis of a glenoid labral tear, if you've had a labral tear, basically you have shoulder instability. And the question I would ask you is, if you have shoulder instability, is your problem really just a labral tear? And I would say no, it's not just a labral tear. That's why just getting labral surgery, just getting it sewn up, probably isn't the best treatment option, because that's not going to address the ligaments in the front of the shoulder, back of the shoulder. So folks who get labral surgery, whether it's in the hip or the shoulder, often have residual pain. And the residual pain is because they still have shoulder instability. I would say even almost every week I'll see somebody who's had some kind of labral surgery and they still have the pain. Why do they still have the pain? Well, they still have instability. And this is why I'm pretty adamant about only use arthroscopy if it's an emergency or it's a last resort. You first should try prolotherapy. The reason is prolotherapy can address all the issues typically that are involved in your joint, that are injured. All the tendons that are torn or stretched out or injured, all the ligaments, the labrum, the meniscus, only prolotherapy can address all the issues. Orthopedic surgery typically involves the shaving of tissue, removal of tissue. Well, what happens when you remove the tissue? All that does is place the joint at greater risk of arthritis in the future. So it might give you short-term relief. Prolotherapy not only gives you some short-term relief, but it'll give you long-term relief. And I don't know about you, but I'm 48. My athletes that I treat in the 20s, they're still going to want to do athletics in their 40s, and I still want to do athletics when I'm in my 60s, 70s, and I may want to do it at a high level. So prolotherapy makes a lot more sense for somebody who loves sports and wants to do it for the rest of their lives.